A medical mannequin is a lifelike patient simulator that provides low-stakes practice opportunities for high-stakes real patient scenarios.
Salina Regional Health Center utilizes mannequins in our simulation lab and organizational development.
I'm Dr. Rebecca Martin, pediatrician at Salina Pediatric Care.
And I'm Tina Hill, education coordinator at Salina Regional Health Center.
Ladies, thank you so much for being on the show. And Tina, thank you for bringing one of our topics with us. We're going to be talking about the simulation lab up at Salina Regional Health Center. Why don't you tell us about the Sim Lab?
So the simulation lab in organizational development has 2 adult high-fidelity mannequins. Victoria is the birthing mannequin, and she has 2 babies with her, one for C-sections and one for vaginal deliveries. Aaron is our pediatric simulator. We have a full-term infant, Avery, and we have a low-fidelity mannequin, and he's an adult. And then Oakley is our newest. She's a premature 30-week simulator.
Well, doctor, and I wanted to have you on here to kind of talk about how you use the mannequins in the training with students. Why don't you take over from that?
Yeah, so I use the mannequins to help run case scenarios with medical students. It's a really great way to use a baby who typically would be a very stressful situation in real life to walk through that process step by step. Using a simulator that gives real-time feedback but allows students to learn what to do in those stressful scenarios. So it provides a really great way to do safe learning in a safe space with a high fidelity mannequin but a low stakes scenario.
What all capabilities do the mannequins have?
Sure. So Oakley specifically, she has a really cool real-time CPR feedback system. The computer she comes with will do audio feedback, so she'll say you're not compressing deep enough, you're going too deep, you need to go faster. It does the same thing for ventilation. She has a lifelike airway, so our physicians can practice intubation skills. Our nurses recently in our NRP, which is neonatal resuscitation program, we used her to simulate a car delivery, so no resources, but still a premature, dangerous delivery. And so the nurses could simulate what they would do in that situation in the emergency room.
It's incredibly important, especially for newborns and for deliveries. We know that 10% of all babies who are born will need help with delivery in some way, and of that 10%, another 10%, so 1% of all babies will need a lot of help. So for anyone who's going into that scenario, whether they're nursing or respiratory therapy, medical students, physicians, residents, this is a great program that allows them to get that practice. Because while it is common, it's not every single day, and you don't want to be doing your very first intubation on a real live patient who really does matter. This is a great way to get a lot of practice in without risking our actual patients.
And we would like to give a big thank you to the Salina Regional Health Center Foundation for providing the financial resources to adopt Oakley into our family.
Okay. Thank you so much for some great information. For more information, please visit srhc.com. Like us on Facebook, follow us on Twitter and Instagram.